Do you know what the 4 categories of death are? In death investigations, a forensic pathologist will often perform an autopsy. During this process, the expert will study the effect of injury, medical treatments, and diseases on the human body, then conclude the manner of death in court. Here are some basic facts about each category of death. Cause and manner of death. Cause of death. Cause of death is a term used to indicate the medical cause of death. It lists the diseases or injuries that cause death. The specific cause of death information is recorded on the death certificate. It is entered into the vital statistics systems of the state of Washington. The reason why an accident occurred, a person took their own life, or why one person killed another person are not investigated by the medical examiner for the purpose of death certification. Manner of death. Manner of death is the way to categorize death as required by the Washington State Department of Health. The classifications are natural, accident, suicide, homicide. Only medical examiners and coroners may use all of the manners of death. Other certifiers must be natural or refer the death to the medical examiner. The manner of death is determined by the medical examiner. What are the 4 stages of death? Natural death. Natural death is typically the result of a disease or an internal malfunction due to the old age. This is particularly true when elderly people have different illnesses and conditions. Still, none of them together or alone might clearly result in death, and it isn't certain which stage causes death. For instance, a person who dies from complications from a heart attack, a sudden heart failure, or influenza should be considered as having a natural death. Most health departments don't encourage listing old age as a cause of death. It doesn't benefit medical research or public health. Homicide. When a person kills another, it is known as homicide. This type of death often requires a deliberate act and might result from negligent, reckless, or accidental activities. In general, homicides can be categorized into many legal types, such as manslaughter, murder, justifiable homicide, capital punishment, and killing in war, depending on the death cases and the criminal's intent or state of mind. These acts of killing can be treated very differently in different countries. While some cases are considered crimes, others can be required by the legal system. Suicide death. Suicide is basically the act of causing one's own death on intention. There are many risk factors for this issue, such as substance abuse, personality disorders, schizophrenia, bipolar disorder, or depression. Those people who have previously tried suicide are often at higher risks for other attempts in the future. The most effective ways of preventing suicide are improving economic conditions, reporting suicide cases properly in the media, treating substance misuse and mental disorders, and limiting access to suicide methods like poisons, drugs, and firearms. The most common suicide method can vary between different countries. Accidental death. Accidental death can be caused by accidents like traffic collisions, falls and slips, or anything without malicious intent. This type of death can still be considered suicide or homicide if the human is the unintentional cause. In many cases, most accidents do not happen by chance, but by negligence or human error. Dismemberment and accidental death insurance policies often pay coverage in the event of accidental deaths. However, the family should prove that it is caused by an accident rather than homicide or suicide. So, what are the 4 categories of death? The cause of the death is usually what determines the category it belongs to. Natural, accidental, homicide, and suicide. Enjoyed this video, give it a thumbs up and share it with your friends so we can keep making them. For more videos like this, hit the subscribe button and remember to click on the notification bell. Also, be sure to check out our other videos as well. Thanks for watching.